The Safepork meeting, as we all know, we're pork producers and food producers, and the safety or perceived safety of the food supply is probably one of the most important attributes of the industry. I got into food safety research when the world was changing in the mid-90s with regulatory changes and a lot of emphasis on let's go and control foodborne pathogens on farms and find out how to do that. So at exactly that time, the Safepork wasn't called that at the time, but basically an international group of foods or pork safety researchers started meeting regularly, started actually the first time in Ames, Iowa, in 1996, and for several meetings it was only Salmonella. Salmonella was the meaning of life, and there was a lot of pressures about on-farm control of Salmonella. We had several meetings where things branched out and started looking at all sorts of foodborne pathogens in pork, and the last 3 meetings, including the one I'll just talk about, which just concluded last week, it's been on foodborne pathogens, zoonotic diseases, but increasingly antimicrobial use, antimicrobial resistance. So I guess the focus of this group has changed with the issues changing and with, frankly, the sources of funding coming towards it. So I just want to give you an overview of, this is an international, very international group, so there's people there from just about all continents, so they're all looking at what's going on in the respective countries in terms of food safety. So it's an interesting place to catch up with what's happening in other countries. So there was a couple of hundred participants from more than 20 countries, so an international group. We had some keynote speakers, Katarina Spark, who was looking at new approaches of and costs of doing more intensive surveillance for foodborne pathogens in the pork supply. Kim Segalis, who many of you would know, is a PCV2 researcher, was talking about emerging diseases. And these days it's hard to escape from the One Health talks. So we had a speaker from FAO talking about One Health approaches to food safety internationally, and particularly in food security and food safety in developing countries. So we had about 100 presentations from people, either as posters or oral presentations, some workshops, and as I mentioned before, quite a bit of focus with a specific roundtable on antimicrobial use and resistance and where that's going, pretty much focused on European developments. Just to give you an overview of what was being talked about, there was as usual, most of the presentations were related to specific pathogens, though we have increasingly a component on antimicrobial use and resistance. And the other category is largely people looking at whole food systems, value chains in developing countries, so not actually looking at traditional microbiology, but how the food supply is managed in different countries and how that impacts on safety. I'll just scoot back there. This gives you a breakdown, and this is comparing the last 2 meetings of what, and we can see this is what the international research community is seeing as things that they're getting funding for and important. So Salmonella continues to be the most researched, the most probably of greatest concern among the foodborne pathogens that are out there. And you can see, the names across the bottom are all names that are pretty familiar. I think the ones to point out, and I think, is this my pointer in the middle, where we've had a little bit of a kick up. So blue is 2013. These are numbers of presentations, and so they're all a little higher. We had more papers presented, but the ones that have gone up more are MRSA, and I'll come back to that a little bit later, Listeria, Toxoplasma. Some of those have been driven by outbreaks. There's been some fairly high-profile outbreaks of Listeria associated with pork in a couple of countries, which has driven a lot of research funding investigation, pretty much entirely focused on the post-harvest sector, and I'll talk about that a little bit later. The other things that have popped up, hepatitis E, there was a couple of papers given at the time. There was an outbreak in the UK. There's increasing outbreaks in Germany that have been foodborne associated. So hepatitis C is something we know is all endemic in our pig population. We know some variants are zoonotic. but it's one that seems to be creeping up on the profile because of these foodborne related cases that have happened. They're still very low incidence, but they're high political potential in terms of issues to be managed in the pig industry as these things happen. And you can see quite a long list of bugs that have been had some attention paid to them. Whoops. In terms of takeaway messages from this meeting, the first one is that on the Salmonella side, there's almost been a total shift away from on-farm control. So when this community started doing things in the mid-1990s, the answer to Salmonella was going to be that we would get smart and find ways to go onto farms and intervene and control it at the source. And that was largely driven by a Danish program with that objective and European initiatives to say that's what to do with Salmonella. What's happened in recent years is that the EU has removed its sort of mandate for on-farm control. Denmark has retargeted its efforts. So essentially that pre-harvest focus has been lost and it's gone away. So we had actually almost no presentations that were looking at on-farm risk factors, on-farm control from Salmonella. And that's a complete reversal from 20 years ago. It doesn't mean that it won't come back again because we've already seen through issues, particularly in the poultry industry in the US and some current outbreak-related things, but there's still people, particularly in the public health community, who are convinced that the on-farm approach is still what has to be done, even though our efforts at doing that in multiple countries over multiple years haven't been very successful. So on the research side, it's gone away. On the, I guess, public relations side, it's still an issue that we'll be working at. The other thing that is notable, you can see this gobbledygook of numbers on the right-hand side there. There's been a global emergence of a Salmonella typhimurium-related variant that's a monophasic so-called Salmonella that is in some countries and in many countries has actually come to occupy a large proportion of the Salmonella that they're finding both in human cases and in some livestock species, including the pig. Interesting, I've got my Australian connections. In the mid-90s, some of you would have heard the name of Salmonella typhimurium DT104. It more or less did the same thing. It appeared from nowhere and occupied a large part of the Salmonella profile in multiple food animal species and human cases. It came and it left, and we don't know why it did either of those things. It never got to Australia. This monophasic is now become very prevalent in Australia, which hasn't imported pigs and lots of other things for a lot of years. So it seems to have spread more internationally, and it's now very prevalent in Europe. Some of you may be aware of the fact there's been an outbreak of Salmonella linked to roaster pigs in the northwest states, centered around a packing plant in Washington, and it just happens that outbreak is involving this same monophasic organism. So that's something that is being wrestled with at the moment, how to manage that outbreak. But again, for old people who've been around Salmonella for a long time, it's not that unusual that we get these waves of new variants that come through and usually go away again. They create a fair bit of panic. It's a multiple resistant strain, and so it's one that we have to watch. And there was just a couple of papers about that really descriptive epidemiology. So that's where the Salmonella picture is. As I mentioned earlier, and very much driven by a couple of things, European regulations and the MRSA issue that I'll come back to. It's becoming an increasing part of the sort of smorgasbord at these Safepork meetings because of the importance of the issues. And we had our session yesterday on regulatory changes in antibiotics in the US. Obviously, those changes have preceded us in the EU, but there's still a lot of activity and research related to antibiotic use and to resistance. MRSA is something that I've been sort of working with over the last 4 years or so. On the US profile, we really haven't had the same extent of public health interest in it, largely because we are yet to have any confirmed human cases of the variants that are identified as livestock associated. The organism is in our industry, and I'll show you a little bit on that later on. But it is an extremely influential issue in Europe. It is the main issue behind the Dutch regulation at trying to mandate specific reductions in antimicrobial use. Two things happening in Denmark. There's been an increase in the cases of human livestock-associated MRSA infections. There's been a number of fatalities, but those fatalities have all been in elderly, severely medically compromised individuals, and there's not yet been any serious reported infections in people who have occupational contact with pigs. So young, healthy workers have a high level of exposure to this organism and an extremely low level of disease, but we still have some yet to be determined routes of transfer of the livestock variants into other segments of the human population, and a low level of clinical disease in the medically vulnerable people. So what that's led to is a couple of things. One of them is in Norway. The organism has arrived in Norway. Norway has undertaken to a depopulation program to eliminate it from their farms. I think they're now up to the order of 50 farms. It's become a very difficult issue for them because the organism is a lot more widely distributed. So at the moment they're wrestling with that. So and as I mentioned, well, the other thing in Denmark is just earlier this year, specifically because of the MRSA, their agriculture minister made a statement to the public that they were going to reduce antimicrobial use by 15%, realising that they already have a very low usage by 2018. And the other statement, which is even more troubling for those in the pig industry, is total elimination of tetracycline use as soon as possible. And looking at the role of tetracycline in human health, it's not that widely used, but the pressure of these small number of fatal human cases and the profile of the MRSA issue in Denmark as a major pork-producing exporting country has turned up a lot of heat on the authorities. So we're seeing those sort of regulatory responses because they have to be seen to be doing something. A statement from the authorities in Norway: when we find these bugs, we will renovate the husbandry, their word translated, to prevent the bacteria establishing. They're killing the pigs and the premises are undergoing full disinfection. So we're seeing some fairly extreme reactions on the MRSA issue. The last thing I'll talk about, this is the shameless self-promotion part, because this is a paper given at the meeting by Ji-Sun Sun, my graduate student, but it was really to bring you up to date on some of the work on MRSA that's here. So we've just concluded a project funded by the National Pork Board. We don't have much in the way of good evidence about MRSA prevalence in the US because most studies have been small and focal. So we sampled, again, a relatively small number of farms, 36 across 11 states. So we had a generally large mainstream commercial operations. Looked at the isolates. We looked at antimicrobial and zinc susceptibility. We also looked at enterotoxin genes because outbreak data implicating pork about the most frequent pathogen is staphylococcal enterococcus, so staphylococcal food poisoning associated with pork products, and obviously we wanted to look at the on-farm reservoir for that. Cutting to the chase here, we found Staph aureus, as you would expect, on 35 out of the 36 farms. I'd actually expect 36. None of these farms that we sampled had MRSA. So if we just crunch the numbers on that small sample size, that would suggest that our 95% upper confidence limit for herd prevalence, if that was a representative sample, which is a different argument, is about 10%. And that's in line with a couple of the bigger studies that have gone on here. So the evidence suggests that we actually have quite a lot lower MRSA in our pig herd here than in most of the European countries, noting that there is a lot of variability in the EU countries. The other part of the picture is looking at Staph aureus and antimicrobial resistance, and a large proportion of the isolates were multiple drug resistant. I've listed the most prevalent resistance patterns that we saw. In terms of zinc resistance, you may not be aware, but there's been work done in Europe that's been implicating use of high levels in zinc in diet as a selective factor for selecting the livestock-associated MRSA, because that a specific zinc resistance gene is co-selected with the MEK-A gene, which confers the methicillin resistance. We had a positive control farm that we were aware of, so we included their isolates. The only place we found the zinc resistance gene was in the isolates from the one positive control farm. Among all the Staph aureus that we looked at from the other farms, we didn't find it at all. This is in line with some of the European data that suggests that generally the zinc resistance gene is very strongly associated with methicillin resistance, and it's not very commonly found in your garden variety methicillin susceptible Staph aureus. So our US data lines up. The other thing, we didn't find any enterotoxin genes in 130 isolates that were selected across all those farms. The importance of that is that it's, and there's a couple of other papers showing similar things, that the enterotoxic variants of Staph aureus that are causing the food poisoning outbreaks are more likely to come from downstream contamination than from the on-farm reservoir. We need to do a little bit more work on that, but it was the purpose that we were looking at that. So again, just the overview of that specific study. Our results support earlier studies showing we've got a relatively low prevalence of MRSA in pigs in the US. We've got a high prevalence of multiple drug-resistant Staph aureus that aren't methicillin resistant. I bring that to your attention now because there are groups who are researching this thing who probably have less affection for the pig industry than I do, and in some of those publications the focus is shifting, because the focus was MRSA's coming to get us, MRSA's a terrible thing. But in the absence of finding MRSA, those reports are saying, well, we didn't find any MRSA or much, but we found lots of multiple drug-resistant Staph aureus. And that is something, looking forward, that we can see that's evolving to be the issue, because the issue that they were looking for wasn't quite there in the same prevalence. So there's a lot of work to be done, I think, in understanding the relative importance of these swine-adopted Staph aureus for public health. Most of the evidence suggests that they probably have minimal importance, but that's something we're going to have to look at a little bit more.